Hello everyone. The topic for today is primary healthcare service delivery, analyzing the effectiveness of partnership and capacity building for sustainable supply chain process. The objective of this paper is to investigate how private sector collaboration and practices on supply chain capacity building can support sustainable process improvements for primary healthcare service delivery. I'm Soumyakant Dwivedy. I am responsible for supply chain in Southeast Asia for Bechtel. Despite substantial investment in health supply chain for developing countries, evidence of primary healthcare level supply chain capacity building and its effectiveness are limited. The focus is more on clinical healthcare support and very little thrust is laid on end-to-end planning, training, evidence-based and systematic decision-making process to strengthen supply chain. The existing efforts are not building capacity to solve problems on a sustainable process. However, there are few examples of efforts to build the effective process on health supply chain. The challenges and gaps are known to many of us. We understand the last mile supply chain is compromised due to various reasons. There are product shortages and wastages. However, the need for root cause analysis and having a preventive mindset is required to solve problems in a closed loop feedback mechanism. Commercial industries have improved their ability to manage the demand for resources by driving collaborative practices like sales, inventory, and operations planning as a framework. The process is not implemented very effectively in the public health sector. This slide talks about the framework of sales and operation planning, which is widely used in private sector. We can term the S&OP or SIOP as COPIM or COPIM, which is consumption planning inventory management, to make it more relevant to public health delivery as the focus is on consumption and not on sales. SIOP has been used as a framework for improving planning outcomes leading to process efficiencies. As per Gartner, there are 5 steps referred to the table on the left, which talks about demand review, supply review, new products planning review, reconciliation, which is one of the key elements in the S&OP meetings, which is comparison of budget versus the bottom of demand, which enables to address the gaps and have a strong response system to mitigate the same. The final step is also having a cross-functional team which works collaboratively to help in structured decision making, which is required at each level of the chain. An effective S&OP helps in alignment across all levels of organization, and using this platform or the process can ensure continuous supply of materials at economical cost. There are a lot of benefits in having an effective supply chain in a public health setup, which can prevent disease and save lives. WHO has estimated that by reducing unnecessary expenditure on medicines, countries could save up to 5% of the total health cost. In fact, forward planning and timely submission of orders can help manufacturer streamline processes which may result in price reductions, better availability, and lesser wastage. There are many levers to take the effective decisions while driving S&OP in a commercial organization. But there are fundamental gaps in private versus public sector healthcare in managing an effective S&OP. The key message is to apply the framework in a public health or a primary healthcare environment and term it as consumption planning inventory management, which we spoke, which, if applied in a healthcare setting, can improve the demand sensing capabilities. This can further help in reducing load at a district level or a state level and help the upstream value chain focus on demand shaping. The framework is basis secondary research, especially the public health side. However, this is very established in the private sector, and more understanding is needed to apply it in a public health environment, either by doing pilots or building center of excellence. Some of the conclusions which we derive out of this secondary research is most of the public health or primary health organization has been managing demand signals by better data visibility to improve the process. However, the other elements like collaboration and capability are equally critical. The key differentiator in improving the process maturity would be collaborative mindset and having the right capability for service delivery. The fast changing technology necessitates an agile process of developing the capability on a continuous basis. The other element is to strengthen the downstream process from an end-to-end perspective and link it with the upstream process, which is basically the bottom-up, top-down alignment process, which happens in an SNOP quite often. There are many examples of collaborative efforts in different parts of the world, especially the LMIC countries in India, Southeast Asia, and Africa. As an example, Brazilian companies demonstrate a 74% correlation between supply chain maturity and performance, which is published by JSI, and similar research around improving the PHC's processes, which happens in various parts of the world. However, we need a deeper insight on the resource competencies managing the primary healthcare service centers to ensure sustainability of service delivery of high quality and lowest cost. To summarize, we need to review the 4A before applying the SNOP concepts in a PHC environment, which is basically assessment, alignment, agree, and adopt. Assessment is where the gap analysis and customized training solutions are mapped to the competency level. The design of effective learning solution, which should be a mix of classroom and experiential learning, has to be done in reflection of the gaps which has been assessed to the specific center and not as a one-size-fits-all solution. The second element is on alignment, which is very critical. Stakeholder alignment is critical as a next step. Often it is good to have a group of experts, a collaborative group or council, which can help enable the change and take decisions. Indicators for monitoring capacity building need to have buy-in from stakeholders or should be revised regularly as assumption-based inflexible monitoring frameworks stifle innovation and risk alienating the project team. Agreeing on the execution plans and defining the roadmap, key stakeholder mapping and RESI, which is responsible, accountability, consulted and informed, and this should be very clearly mapped at a very grassroots level, as well as both upstream and downstream. Finally, running the coping process as defined frequencies to start the journey of continuous improvement, which will strengthen the team for building competencies and drive long-term growth. The next conclusion was to check the correlation between collaborative efforts and capability. Our attempt has been to design a framework, a 4S framework, which can help understand the primary healthcare service delivery models. Our approach based on degree of collaboration and capability. The fourth quadrant is to explain the different ways the service delivery model for primary healthcare can be applied. X-axis is the capability and the y-axis the collaboration. The right hand bottom corner is siloed. Siloed is where there is high capability but low collaboration. leading to fragmented approach to manage the process. This has been one of the major reasons for SIOP process failures or lack of collaboration, and needs concerted efforts to address the mindset apart from building the right competencies. The left hand corner is stopgap. Stopgap can also be considered as flexible or ad hoc process management where there is low degree of collaboration and low expertise. The cost will be high and may be applicable during emergencies where the primary focus will be on service delivery and continuity of life. From a supply chain standpoint, this can be used as a spoke for humanitarian logistics or support for health emergencies. The left hand top corner is systematic. Systematic is process dependent and can be managed with low capability. From a supply chain standpoint, this can enable auto stock replenishment if the end-to-end process is integrated. However, this level of high collaboration can be achieved with sustained efforts over a period of time. Often having collaborative groups or councils can help take effective decisions and influence stakeholders for improving the collaboration. The collaborative groups need cross-functional stakeholders and must meet periodically to derive the public health improvements. This has been also used in private sector as an executive decision-making forum and found to be effective in driving change or improvements. Another example is use of telehealth or telesolutions, which is dependent on technology, to help address some of the capability gaps. There are some examples of work done by social innovative startups like ICure who are working in this segment. There are good examples of improvements in Brazil and Bangladesh public health supply chains by strong private-public partnership. There are reports by JSI on the same. The top right-hand corner is sustainable. Sustainable is the best-in-class process where both capability and collaboration are of the highest level. From a supply chain standpoint, this can also help in smooth stock replenishment, transport options, etc. This also needs system data integrity and discipline, which can be enabled by high capability and collaboration at a local level. A lot of efforts in various countries in public health has been dependent on financing or funding, and often the outcomes get impacted with the funding being pulled out. Getting to this level of efficiency will need social entrepreneurs who can run the system efficiently. The model must move from public-private partnership to individual public ownership and will need support from local government and funding agencies to empower the social entrepreneurs to drive change and development. Good example is Kasha. Kasha solves many of these problems by bypassing the retail channel and providing direct to home or designated pickup points delivery of women's health products in Rwanda and Kenya. While this framework is an attempt to check how primary health care can be segmented in different ways and not to paint them in the same brush. There are good examples of sustainable PHCs, systematic, and some, of course, siloed. Another way is to look at using the primary healthcare centers at a stopgap for emergency and disaster management. Finally, the diagnosis of creating micro supply chain with focus on end-to-end process mindset, which can be enabled by awareness, action, and access. Distribution of globally or nationally procured commodities is facilitated by grant monies provided to country governments or large NGOs. The challenge seems to be similar for primary healthcare, where there is need for having continued support by public-private partnership to enable improvements. which can better manage the last mile service delivery and help lessening the burden at the hospitals and reduce out-of-pocket expenses for the community. A more holistic solution for addressing the last mile should be developed by sustainable micro supply chains. The first step is to create awareness on end-to-end mindset, which needs to be enabled by implementing more sustainable process. Just like what you see on the left hand side is where we have the primary healthcare at the entire center of all the service providers in terms of the supplies coming in. There are redistributors if there is excess stocks, and then moving into the next destination like sub centers or further down in the chain, and also avoiding wastage, and if at all, then looking at recycling, which is more in a circular supply chain concept, and then also passing the demand up to the upstream channel. So this is where we need to understand that the solution can happen on the ground by if you are aware of the supply chain end-to-end processes. The other element is on data capture. We need to leverage the use of local tools for data capture, which is a key for visibility, and then work on centralized solutions for data integration at upstream levels. And there's a lot of learning from private sector on working with large multiple distributors in Asia, where each distributor have their own local ERP tools, and integrating a one top-down system is very challenging. So the best solution what we got was to get all those information centralized to a central data repository and then integrating to the tools this organization have, which helps in the data visibility. Of course, you need discipline of data governance, which is possible, and the possibly the same should be applied in a public health or a primary healthcare setup, which will help in terms of data capture and data visibility across different elements. Third is having a sustained support to have a pilots, which I strongly believe to have a center of excellence to improve capability, capacity, and processes, because this is a continuous learning process. Fourth, this can be further enabled by partnerships with supply chain experts from public and both private sector, and having evidence-based advocacy approach. There are good examples of partnerships by companies like Coke, P&G, which has helped improve the last mile service delivery, but we need more of them to make the last mile stronger and focus on micro supply chains. Thank you.
So, Soumyakant, if you had anything else you wanted to add or anything to like anything you wanted to add to your presentation, go ahead and you can go ahead and just again add anything you wanted to say.
No, not specific to this, but the idea was to understand some of the process and practices what we run in private sector, and see how we can apply at a primary or a the last mile healthcare service delivery. So the key is to do some pilots. And presently, we are supporting some non-profit and see how we can get a small pilot done in Asia or Africa. We haven't don't have the network, but it's good to do that and actually apply it. And the idea is to, like we have heard microfinance, but we haven't actually applied micro solutions or micro distribution or micro supply chain. I think that is the key for long-term sustainability. So that's the process, and we'll build the paper more and probably with some evidence, and then we can actually take it to the next level. Yep.
All right, awesome. Good morning, good afternoon. We're really excited to be here to talk to you guys about secondment programs. My name is Emma Mihevc, and I work at Johnson & Johnson, and I'm doing a special assignment in global public health.
Hi, and my name is Alex Calderaro. I also work for Johnson & Johnson. Both Emma and I have backgrounds within the business side of the supply chain business, but as she mentioned, we're doing special assignments in order to help the global public health group as well. And we're really excited to be here today and talk to you guys about secondment programs. As some of you might be aware, Johnson & Johnson's really committed to changing the trajectory of healthcare, and this is one way that we're able to get involved in the global public health space to do so. We were able to partner with the People That Deliver organization, which is a coalition of organizations that are committed to enhancing healthcare supply chains, and it was a wonderful opportunity to us. We're very, very excited to share with you the information that we've got on secondment programs today. If you go to the next slide. Thank you. So first, I'd like to just go through an agenda of what we'll walk through today. First being our purpose, or what drove and inspired our motivation to look at human resource constraints in Sub-Saharan Africa. Then move on to our focus, how secondment programs help to alleviate some of those constraints. Then looking at our data, some of the people that we were and companies that we were able to engage with as a result of working on this project. Finally, sharing with you just a sneak peek of our learnings and a little bit about our strategy guide that we ultimately developed. And finally, concluding with some discussion and next steps. Specifically, we were able to get really great engagement from the private sector in the information that we've collected thus far, but would really love to get more feedback on the public sector's approach, and would love it if any of you could provide more information on that. Next slide. Thank you. So first, going through our purpose and the need state that we have in Sub-Saharan Africa. So back in 2019, Johnson & Johnson, in partnership with Deloitte, did a deep dive mapping exercise of several countries in Sub-Saharan Africa. And some of you might be familiar with this information or have seen this slide before because it was presented in last year's Global Health Supply Chain Summit. And in analyzing all of these countries, there were several specific areas of focus that were identified to enhance overall healthcare supply chains. One of those areas that was targeted across all of the countries that were researched was a human resource challenge, whereby individuals that were working in public health supply chains were constrained in terms of training, tools, and overall just knowledge on how to enhance public healthcare supply chains. If you go to the next slide, please. Thank you. One solution in order to help enhance that knowledge across the public health supply chain in Sub-Saharan Africa is secondment programs. So what are secondment programs? Secondment programs are partnerships between the public and private sector that allows knowledge to be shared, training to be provided, and overall the constraints that the sector has to be alleviated by collaboratively managing a dedicated resource, typically from the private sector. What this looks like in practice is that an employee that typically works for a private sector company and is currently employed by them will be seconded or lent to a public sector organization on a special assignment or project in order to target one of the areas that may be lacking that knowledge that we spoke about earlier. When we look at programs like this, ideally we're creating a triple win between the three key stakeholders involved. The first stakeholder is the participant, or who we'll refer to as the secondee, and that person is able to gain professional development from working in the public sector group as well as getting that special assignment. That person's often sponsored by a private sector group who we'll call the home company sometimes. And that group is able to support communities as well as understand how to create solutions that are viable in global markets, as many current healthcare companies are ultimately trying to change healthcare for all countries and maybe not just ones that have the knowledge already existing. And finally, the public sector, who we spoke about earlier, who we'll call the host company, that group can gain the knowledge and resources that they might be lacking thus far. So when looking at what our project targeted, we were really looking to support the creation and continuation of public and private partnerships through these secondment programs and helping companies and organizations that want to either start or participate in secondment programs through a strategy guide. And by speaking with a bunch of different individuals, we were able to define some best practices, lessons learned, and an overall process flow in order to help companies start and facilitate a successful program. Emma will now go into some of the individuals who helped us make this guide possible and who we discussed with along our journey.
Yep, if you can go to the next slide. So in order to make this strategy guide that we started to put together, we really wanted to do a mapping of what secondment programs existed already in the industry, what some challenges might be when putting a secondment program together, and then what are the best practices, what makes secondment programs successful. So we were able to interview and survey 25 individuals across healthcare supply chains. And I would say the people we spoke to were predominantly from the private sector. As you can see here, we talked to people who were seconded, people in private organizations, and then some intermediaries. And you can see the different organizations we spoke to, where they were kind of seconded in all the different spaces. And a big reason for us wanting to come present today was we're hoping to get more engagement from the public sector or even more from the private to better understand best practices, challenges, and what they've seen across the board in secondments. So I'm going to jump to the next slide and talk through some of the partnerships we were able to observe when we were doing this mapping. Can we go to the next slide? Thanks. So we were able to observe 3 different types of partnerships, the private to NGO, private to intermediary or broker, and then private directly to the government. Each of these different partnerships have their own advantages and challenges and are unique depending on who is doing it. So the first one being a private company connecting directly to a public organization. Some great parts of doing this kind of partnership is there's clear buy-in typically from both parties with an ask and need. Both parties are communicating and talking because they had to build that relationship in order to come up with a problem statement. Some challenges here are pre-existing relationships are typically required and can take time to develop, and then it can be difficult to understand long-term impact. The next type of partnership is a private company connecting with an alliance, federation, or NGO, and who then gets connected to a public organization. An example of this would be a private company working with a group like the Africa Resource Center, and then the Africa Resource Center connecting that private company directly with a public organization. Great parts of this kind of partnership is that you can leverage existing relationships and credibility. So intermediaries and brokers typically are very involved in the space they work. They know the people, they know the organizations, and you can leverage that network that they already have. Challenges here is you have increased number of stakeholders, and that just makes it so you have to further define roles and responsibilities, and there needs to be extra communication to make sure everyone is on the same page. The last type of partnership is a private directly to the government. This really cultivates good relationships between private organizations and the government, and it really highlights the intention of the program. However, there's some challenges in doing it this way, and that it can be kind of time consuming and difficult to manage as it is a resource constrained setting, and it can also be difficult to build trust. So across all of these different types of partnerships and all of the people we interviewed throughout this process to learn about secondments, we were able to kind of find 3 keys areas of 3 keys to success. Sorry about that. Can we jump to the next slide? So for our 3 keys to success, the first one is really around mutual buy-in. What Alex kind of spoke to and what we've really learned across the board is that a secondment is a partnership between private and public. A private company could be lending resources, could be lending their network, but it doesn't work unless the public organization is just as engaged. So the projects really need to be a pull from the public space in order to get the correct engagement and not a push from the private. And in order to kind of have this collaboration and this to work best, it's great to have a clear problem to solve in an ideal end state, but we know the public space is very dynamic. And so the private organizations need to be able to account for that. And in order to do that, the next 2, continuous communication and engaged stakeholders, are really important. So in order to get this mutual buy-in and to have a successful program, this continuous communication through onboarding, preparing, and then throughout the process, and then having engaged stakeholders, so the correct candidate and then the correct receiving company, and everyone being on the same team and this shared collaborative experience is really important to make a secondment program successful. So with these keys to success, we were able to kind of see them across all different aspects of a secondment program. And in our mapping, we were able to put together areas of focus and that what an organization would want to do in order to create a successful secondment program. And we just ask that these keys to success are considered through each of these stages. So Alex is going to kind of walk you guys through the overview of the different steps and areas of focuses for a secondment program. If we can jump to the next slide. Thank you.
Great. Thanks, Emma. So as Emma mentioned, there are these key tenets to success, but in order to create a comprehensive guide, one thing that we wanted to do was provide a process flow for the different phases that would be needed by both the private and the public sector groups in order to make sure that a secondment program was successful from its creation. Mohit, what I'll ask you to do is click through each of these as I kind of walk through them. So I'll just prompt you with the click if needed. So the first click and the first phase of this is really the creation of the program and promoting that collective buy-in that Emma spoke about earlier to make sure that the project is truly pulled from the public sector versus pushed from the private. The next phase is going to be structuring. If you can click there. Yep, and that's all about setting the clear expectations and creating sort of foundational elements that allow all of the parties involved to have a standard for what the expectations are as we move through the program. The next one is recruiting, if you want to click there. Yep, and that's all about finding the right candidate and making sure that the person that is selected to participate in a program like this is as dynamic as the public space that they'll be working in. Next is preparing. And this is really about training all of the stakeholders involved for the journey. I'll go into this slide more in a little bit. So I'll save a lot of the details here. Next is onboarding. And that's really about what happens when the candidate arrives on site at these individual locations and making sure that we're creating a structure that establishes trust for those individuals. We move on to supporting, which is really about creating a structure whereby the candidate can reach out to different lifelines at both the home and the host organization while they're on assignment in order to provide an update and make sure that we're facilitating success along the way. And finally, certainly not last, however, is tracking, which is measuring success along the way, both while that person is on assignment as well as after. And this is critical in terms of ensuring the longevity of the solutions that are being developed. Although this is a sneak peek of all of the focus areas that we worked on and the full ideas available in our guide, we wanted to dive a little bit deeper into preparing, as I mentioned earlier, in order to give you a flavor for what the guide overall looks like and how it's structured, as well as showcase some of the information that we were able to get from the individuals who we spoke to. I want to click again, and we'll go through preparing now a little bit more for the next slide. Great, so preparing, and this is a structure of what the rest of the guide looks like and how we go into each of those areas of focus. So when we look at preparing the stakeholders for the journey, we wanted to emphasize with the group how important training and setting clear expectations are, not only with the individual that is going on assignment, but also all of the necessary stakeholders that involved. So the secondees all felt more comfortable when they were provided training. And that training included information on the political climate that they were working in, any cultural awareness that they should be aware of, leadership, as well as project scope. And host organizations were able to promote success not only of the secondee, but also of the stakeholders through preparedness. So when we talk about stakeholder training, we're talking about the stakeholders at both the host company and the home company in terms of expectations for when they should be available, what kind of support they should be providing, as well as a communication plan. Some of the key tips and tricks and most helpful feedback that we got from the people that we spoke to about preparation was, one, fostering relationships between the secondee and the host organization early in order to make sure that that person knew who to go to right when they arrived on assignment. Another one was leveraging private sector internal resources, whether that be the internal network or any trainings that the private sector has on the culture, the climate, or anything specific to the project scope that they'll be working on. These help the candidate feel a lot more prepared when they arrived. And finally is identifying those internal resources and network prior to departure to allow them to leverage that network while there. It's always more difficult when they're acclimating to the new environment and trying to navigate the new network that they'll be in once they arrive. But if candidates were able to establish that before, they had many different people to reach out to who they already felt comfortable with when they arrived on assignment. As I mentioned, this is just one of the focus areas that we have this level of detail on. And if interested, you guys, we would love to send you this information. We're really proud of the guide that we put together and want as many people to provide feedback to improve it and as well as be able to enhance it as possible. If you go to the next slide, Emma will wrap it up and we'll move into Q&A.
Yeah, so like Alex said, we're really excited about some of the information we've been able to put together so far, but we're also very much looking for further engagement, especially from the public sector. So if you or anyone you know or any organizations you know of are involved in secondment programs, both public and private, we'll take anything. We would love to kind of get your information. So we have this QR code at the bottom, and then also there's been a link posted in the chat that you could fill out, and so we could get in touch with you after this, in addition to kind of giving you guys more information on our progress on what we're working on. So we wanted to open it up for a Q&A session. So if there's any questions or any comments, feel free to put it in Zoom, or you can also unmute yourself. We don't bite. So yeah, thanks again for listening today, and we look forward to either hearing from you in the QR code or any questions you might have.
Thank you so much.
Thanks.
Thank you, guys. Like they've said, they're now open to questions. If you drop them in the chat or raise your hand, I can then call on you, and you can unmute yourself. Alexis, I think you can unmute yourself. Go ahead and ask.
Okay, thanks, Mohit, and thanks, Alex and Emma, for your presentation. Since the other participants didn't have any questions yet, I was just wondering if you could give us a little bit more information about what you learned in terms of the metrics for success. How can you tell if a secondment program was successful? Thank you. Over.
Yeah, thanks, Alexis. Yeah, so I think in terms of metricing and success, this is something we've really been challenged with and had a hard time of kind of getting solutions. I think it's the thing we ask people and they're like, oh yeah, it's really difficult to understand our impact, especially from the private side, or it's difficult to understand what happens after we leave. And so that's why we really are trying to get some further engagement to better understand what best practices are in terms of metricing and figuring out the amount of success one of these programs might have in an organization.
Yeah, and I think there were two things that also were clear to me as we interviewed people. One, that right candidate ultimately is someone who has that people-to-people engagement and is willing to follow up on the success of their project as well as the sustainability of it after they leave. And if not that person, creating that kind of historical database within your company of what projects have been done, what organizations you've worked with in order to be able to individually follow up with those groups as well, and continue supporting them after the assignment's over.
And it looks like there is another question. Is the ideal candidate for a secondment someone who is an SME in something? Alex, do you want to take that one?
Yeah, absolutely. I think one of the things that we found as we spoke to people about who the right candidate is for this, it's definitely important to have someone who has knowledge of the issue, but the more important thing is that the individual is flexible to the dynamic environment that they're working in. So as you're recruiting candidates, I wouldn't shy away from someone who might not know all the answers, but find the person who's willing to figure it out and navigate through an ambiguous environment.
Yeah, and I think this is one of the ones we've gotten kind of mixed feedback on in terms of, is it great to have an SME and someone who knows everything, so a subject matter expert, or someone who's really adaptable? And I mean, obviously the ideal situation is you'd have both, but it's important to remember that people can leverage back to their private organizations. But this is another question where we're trying to better understand from the public space, especially what they prefer to see and what fits them best. Do they want a subject matter expert or someone who is kind of a generalist and can help in multiple different ways? So both of these I think are great examples of things we're trying to learn a little bit more about in terms of how can we track metrics better, and what kind of candidate is best in the into the public space. So thanks for the questions.
Thank you.
Thank you, guys. We're gonna continue on to the final presentation for the day. So I'm just gonna share the video file that they sent over. Thank you.
So, hi everyone, my name is Emily Lawrence and I'm a manager at Village Reach on our Research Evidence and Learning team. Today I'll be presenting on work we're doing at Village Reach to partner with the private sector on outsourcing companies known as fourth-party logistics managers, or 4PLs, to deliver medical products and personal protective equipment to the last mile in Mozambique during the COVID-19 pandemic. Before I get started, I would like to acknowledge the other authors of this presentation and abstract, Lucille Williams, Baltazar Chilundo, Craig Usswald, Ruth Bechtel, Aida Coelho, Frederico Couana, and Lucille Bonaventure. Can you go to next slide? Great. So in today's presentation, I'll provide a background on our program, the Last Mile Supply Chain Program. Then I'll briefly talk about how our program has responded to the COVID-19 pandemic in Mozambique. Then I'll discuss our program's performance during COVID-19. Lastly, I'll end the presentation outlining what we see as the key success factors for being able to maintain uninterrupted deliveries during the pandemic. And we really hope that these lessons can be helpful for others looking to implement similar transportation models. Next slide. Before I dive into the specifics of the Last Mile Supply Chain Program, it's important to understand what gave rise to the program, which is the Mozambique Pharmaceutical Logistics Plan, which was developed by the Mozambique Ministry of Health to address the lack of reliable and appropriate warehousing, lack of transportation, finance, and poor data systems to manage supply chain logistics, all of which have led to historically inconsistent delivery of medical commodities to health facilities in Mozambique. So in order to overcome these challenges, this plan outlines 7 strategic building blocks to address these pervasive challenges. These building blocks are, first, the creation of an enabling environment for medical commodity procurement. Second, creation of an information and performance management system, new network design, new organization structure, outsourcing to the private sector, changes in human resources, and changes in finance. Next slide. So it was out of this Mozambique Pharmaceutical Logistics Plan that the Last Mile Supply Chain Program, the program we'll be talking about today, was developed. And was specifically developed to address the 2 pillars, outsourcing to the private sector, and also to contribute to the creation of an information and performance management system. So this program is a 5-year cooperative agreement funded by USAID, with the goal of improving availability of medical commodities at the health facility level by ensuring health facilities receive commodities in full in a timely manner. The program began in just one province, Zambezia province, covering 2 districts in October of 2018. And since then, the program has expanded to 4 additional provinces, making a total of 949 monthly deliveries, monthly deliveries to a total of 949 health facilities, In the coming year, we also are planning to scale up to 9 of the 10 provinces in Mozambique. So we'll be operating in almost the entire country by the end of next fiscal year. This program consists of 4 core components. So first is Village Reach management of the 4PL, or the fourth party logistics manager outsource company. In this case, we work with 2 different 4PLs, Valore Transport and Logistics and Agility. And we provide mentorship to the provincial government on how to work closely with the 4PLs and with the private sector, and vice versa. We work with the 4PLs on how best to work with government. Second, the most critical activity of our program is 4PL execution of outsourced transportation of antiretrovirals, rapid test kits, vaccines, and essential health commodities through third-party logistics transporters. And then third, we've implemented a system to track, manage, and plan distributions. So this is helping to increase visibility of the transportation supply chain. And finally, we will be transitioning program ownership and operations of this program to provincial and national government over the next several years. Next slide. So it's in this context that we had been implementing the last mile supply chain program in Zambezia for about 2 years prior to COVID-19, and in our newer provinces for just under a year, and some we actually began implementing in those provinces when COVID-19 had already been spreading in Mozambique. So when COVID-19 hit Mozambique, the country mobilized very quickly, understanding the potential for COVID-19 travel restrictions to interrupt medicine supply. So for example, in the space of 3 weeks, because of private sector flexibility of the 4PLs, Last Mile Supply Chain Program was able to support the Mozambique Ministry of Health in responding to a need to deliver to 3 months supply of ARVs to health facilities to ensure that people living with HIV/AIDS could get a 3-month supply of medication and limit their travel and exposure to health facilities. Additionally, the 4PL companies were able to mobilize their own resources quickly to ensure that their staff and 3PL contractors or transporters were equipped to conduct safe distributions with COVID-19 safety and prevention measures. We were also able to work quickly with the government of Mozambique and the 4PLs to create protocols and processes to mitigate risk of transmission on picking, packing, loading, and verification of transported commodities. Finally, as we were expanding to new provinces at this time, COVID-19 really forced us to adapt our approach to implementing in new provinces, conducting remote assessments, remote meetings, and kind of streamlining our new provincial implementation process. So this assured expansion of the program to new provinces during the COVID-19 outbreak, and therefore, increasing access to medicines and opening avenues for more efficient ways for us to conduct business in the future. Next slide. So we believe that due to these measures put in place that I just described, we were able to maintain and improve on some of our key performance indicators. So here I'm providing an example of how we've seen that in 2 of our key indicators. The first one being execution of deliveries to planned number of health facilities. So you can see here prior to the pandemic, January 2019 to March 2020, on average, LMSC delivered to 97% of planned health facilities in just 3 provinces. And since the pandemic, we're now delivering to an average of 96% of planned health facilities in 5 provinces. So we were really able to largely maintain performance in this indicator during COVID-19 with while still expanding our geographic footprint. So really uninterrupted delivery of commodities from the provincial level to health facility level, despite new pandemic restrictions. Next slide. Perhaps more striking is the improvement we saw on average percent of health facility delivers which were on time, which we define as between 25 and 35 days from the last delivery to a health facility. So prior to the pandemic, during January 2019 to March 2020, on average, LMSC delivered to 60% of health deliveries. And then since the pandemic, we're now delivering to an average of 76% of health facilities on time, with that, again, expanded footprint of 5 provinces. I should caveat that some of this improvement was actually largely reflects improvements we made as a team as we move from the startup phase in the project to full implementation. However, the thing to really highlight is the sustained improvements following COVID-19 also demonstrate how the partnership with an outsourced transportation company ensured those consistent on-time distributions during the pandemic. So health facilities could really continue to count on us to receive health commodities on their planned dates. Excuse me. Next slide. Thank you. So in addition to being able to maintain our performance and our key performance indicators during the pandemic, we were also able to respond to new emergency requests from the Ministry of Health. And so I alluded to this in the beginning of the presentation, but talking about how LMSC was able to deliver a 3-month supply of antiretrovirals to reduce exposure to HIV patients to COVID-19. This was a non-planned emergency distribution that the 4PL was able to really quickly respond to and act on. Additionally, we are planning to integrate PPE into routine deliveries. So the planning for these distributions will happen during technical working group meetings at the national level, where they'll forecast volumes. And as long as the 4PL knows what volume they'll be transporting, they can easily accommodate the extra commodities. So being able to ensure routine delivery of PPE through 4PLs is really critical, since most health facilities don't have the space to store large quantities of PPE safely. Being able to provide routine, on-time, and reliable distributions are really key to ensuring availability of PPE where they're needed most. Next slides. Last slide. So keeping all this in mind, our team reflected on kind of what have we felt have been the success factors to being able to quickly respond to this new environment and maintain uninterrupted deliveries during the pandemic. And we came up with 3 critical factors that we think have contributed to this success. So first, we found that a 4PL, that these private outsourcing companies can really quickly hire transporters and deploy vehicles based on demand. So within their company, they have flexibility to shift resources to essential industries that are increasing demand, like transport, like public health transport. So one point to add here as well is that the 4PL also was able to only work with transporters who could ensure minimum COVID safety and prevention measures are in place. So that flexibility of the private sector to shift resources within their own company and put more resources to where there is more demand really helped them being able to respond to these requests very quickly. Second, private sector quickly redirected funds to be able to purchase high quality personal protective equipment for their staff and train them on COVID-19 prevention. So again, kind of that agility and flexibility in funds to be able to direct them where they're needed to be able to respond to this increased demand and increase pressures put on their business. So the 4PL, in addition to that, we also required the 4PL to submit to Village Reach their plans and processes for ensuring safe distributions and COVID-19 prevention measures. And to date, we've had no COVID outbreaks reported or linked to any routine distribution processes. We should also note that in addition to all the transporters, having PPE, Village Reach also supplied PPE for the government staff directly involved in distributions, while 4PLs ensured that their 3PL transporters were adequately equipped. And I apologize for all of the acronyms in this, hopefully you're following. And then our last lesson learned is that 4PL private sector operations are really routine and structured. So this results in a strong and mature distribution system that can easily respond to these emergencies, such as increased volume being transported of PPE or having to increase volume of emergency supplies of ARVs. So 4PL as a private sector company, they're simply more flexible and nimble in their operations, and their focus is really on responding to demand, as I mentioned earlier. While we've found, and just again in our team reflection, that NGO and government tend to be a little less flexible and nimble, often due to donor requirements or other internal regulations. So we really found that this kind of trifecta of using 4PL to actually do the distributions while partnering with government and NGO has allowed for increased flexibility and nimbleness and routine and structure in the distribution system. And yeah, that's my presentation. So thank you all so much, and happy to answer any questions if you have them.
There is a question. Soumyakant was asking, is there a long-term partnership with the 4PL or was it specific to this project? What was the evaluation technique to select the right 4PL in this project?
So that's a great question. So with this project, we're setting up like a tendering process, and I can direct you to our technical director if you want more details about that. We have put in a toolkit in place for how to select 4PLs. And so specifically for this project, we are working with 2 4PLs, and there was a lot of intentionality in making sure that we're not just selecting one 4PL to do all distributions for all Mozambique, because we want to be able to set up a robust private sector with competition. So that's why we do have 2 4PLs working with us. And, you know, there are talks of eventually moving forward that USAID may be managing those contracts, and hopefully eventually the government would manage those contracts and be able to take over that tendering process and selection process for how they select a 4PL. So feel free to reach out to me in the private chat. And if you want more information, I'd be happy to put you in touch with our private sector director lead, Joseph Russell, who has really set up that process for how we select 4PLs.
Thanks, Emily. So Mohit, if I can ask a related question because typing was longer. I think Emily, yeah, thank you. I think the challenge what we have is there are a lot of local players who might be more sustainable rather than giving to 4PL who may not have that strong network. I think that is where the evaluation question came up. So sometimes at a very high level, you may find some international players to be quite capable at a different geography, but may not be at a ground level in Mozambique or in a state in India or in Southeast Asia. That is where the question was. So if there is a framework, I think to have more sustainable local partners, it may be a good way to progress. Yeah, thank you.
Yeah, I think that's a great point. And again, I'm not as involved in that particular process with this program, but I do know, in terms of that sustainability question as well, we also have been doing a lot of the work with the 4PLs around their prices and working with them to lower their costs and optimize costs of transportation, particularly the transportation component, and to be able to make them more sustainable. But I do know that internally there have been discussions around, the use of more local 4PLs, and as opposed to these larger, international companies like Bolloré, for example. They're a huge international company, French. So yeah, I think it's a great point, and I would be happy to put you in touch with our private sector lead, who I think can provide a lot more insight into your question, because I think it's a great one.
Yep. Thank you, Emily.
Yeah, thank you. And I see another question. Oh, sorry, go ahead, Mohit.
Yeah, the other question is, and it's from Anoop, did you work with only one 4PL or increase their number as the load went up? And for what period were these 4PLs hired?
Okay, I'm not sure if I understand the first one about increasing their number as the load went up, but we did work with we've worked with 2 4PLs, and more than just one. And for what period are these 4PLs hired? So they are hired on a yearly basis, but we have quarterly performance reviews with them. And I'm not positive, but they might have to go through their tendering process, that selection process, every year. And again, we do quarterly reviews where we go over finances, performance, etc. And in terms of increasing their numbers as the load went up, yeah, I'm sorry, I'm not sure. I don't know if you could provide further clarification there.
What's the question? My network was a little bit unstable.
Oh, no worries.
Emily, what's the question?
Yes, go ahead.
She was asking for a clarification for what you meant by increase their number as the load went up.
Yeah. So I think you answered that. You said that you had increased from 1 4PL to 2 4PLs. That's what I think you answered already to Soumyakant's question. And I was just trying to find out that for what period were these 4PL partners hired? For what period? Was it a 12-month period, or are they, you know, what kind of contracting was done with them?
Yeah, so we, it's for a 1-year period, but for example, Bolloré, we've ended up hiring, again, each, you know, they've now been with us for 3 years, but we go through a contracting process with them every year. We fill out and revise a service level learning agreement, an SLA with them every year. And I'm not positive if they have to go through the tendering process every year, but I can certainly get back to you with more information if you would like that. You can feel free to, I can put my email in the chat and you're more than welcome to send follow-up questions, and I can direct you to our technical director who has really led that 4PL contracting, but it's a great question.
Fair enough, Emily. Thank you so much.
Thank you.
Emily, it looks like we have another question in the chat. Bridget was asking, is the toolkit you mentioned for how to select 4PL something that can be shared?
Yeah, let me get to I can ask the team internally. It's great to know that there's a lot of interest in just how to hire 4PLs. I didn't know, I don't think as a team we've realized that. So I will ask our chief of party if that's available to be shared, and if so, would be happy to reach out with that. I'll put my email in the chat and folks can feel free to send me an email with these questions, and I'd be happy to follow up. Because I'll double check, but that would be great if we could share it, and we can certainly consider doing a presentation simply on selecting 4PLs as well, maybe in the future, because it seems like a high area of interest.
Alrighty, so it doesn't look like we have many more questions. Again, I want to thank the presenters. They were wonderful presentations. Thank you all for joining.
Thank you.
Thank you so much.